time slot. The Diabetes Reversal webinar is now on Tuesdays at noon Central, which is 10 a.m. Pacific or 1 p.m. Eastern time. And I've got a special surprise for everybody today. Now, as people are hopping on here, I think we need to get moving a little bit. Can you guys hear that music? I'm not a good dancer, but now, hey, if you're watching, get up out of your chair. Put those down. Put those chips down. Here we go. There we go. Come on, get up and move. We got to be moving. You got to be moving like you mean it. Oh, yeah. Has everybody left yet? Oh, people are still joining. All right. Woo, yeah, come on, get up and dance. This is the Diabetes Reversal webinar. Hey, Leslie, get up. Dr. Saunders, let's go. You're typing, you can type later. Come on.
I gotta get this shared to Facebook. I'm dancing in here.
There's the moonwalk. Yeah.
Okay.
Dancing. All right. Thank you, thank you. Hey, it's good to get the blood flowing. All right. We've never done that before.
Oh, I'm so distracted. I don't even know what's happening anymore. Okay.
I can tell you've never done that before.
Yeah.
That was good. That was a good way to start the webinar.
Yeah, that's right. That's right. Good way to start this week's Diabetes Reversal webinar. I'm Joe Barton, your host, and today we have Leslie Prenz, shout out.
Hello.
Yeah, and Dr. Scott Saunders.
Hey, that's me.
Yeah. All right. So today's topic is medications. And so if you are joining us, let's have you say hello in the chat. Tell us where you're from and be honest. Tell us if you did a little bit of dancing with us, if you did it in your chair or if you actually got up and danced. I want to hear it. All right, Dr. Saunders, as people are typing, why don't we tell them about what we're going to be talking about today.
Okay, so today we're going to talk about medications, and it's sort of a repeat that we have talked about medications in the past, but we've had a lot of questions about medications, taking medications, which ones are good, which ones are not good, how to take them, when to get off them, all of those questions that have come up, and they come up frequently. So we thought it'd be a good idea to go over the medications again, to look at what you're taking, why you're taking it, whether you need it or not, and how diabetes can be managed, well, with the medications and then without the medications. So that's what we're going to look at today.
Awesome. And Leslie, I'm going to put you on the spot, but can you give us a little disclaimer here for, so that people don't go crazy here?
Okay, so I don't actually have it in front of me, so I'm not going to read it, but this is my advice. Please consult your doctors or physicians or whoever you work with to get the best advice for your bodies.
Yes, this is meant for informational purposes only. Dr. Saunders is not your doctor, probably. I mean, he could be if you actually work with him, but most likely he's not. So before we're doing anything or trying anything or stopping medications, be sure to be working with your own doctor to do that, especially as we're talking about medications today. So, all right, Scott, can you tell us, is there anything new in the world of medications for diabetes over the past year or two?
Well, there's the newer medications, there's like what they call Me Too drugs. So they start out with one, like Januvia, for example. It has several other ones now called Nesina. And essentially it's the same thing, but a little different. So a little different twist on the same drug. So there isn't anything new as far as really new, but there are some new drugs in the same type, the same family.
Okay. Door shut behind you. There you go. They must have heard
Shut.
you dancing.
Shut for good.
Yeah. Okay. So yeah. So if somebody has diabetes, at what point does a doctor prescribe medications, and what kind of medications are they typically given?
That is fascinating. It's actually highly variable. At one doctor, the same person might go and get several medications to start off with, just barely slight elevations in hemoglobin A1C, whereas at other doctors, they might get a metformin only, for example. And other doctors might say you should try a diet first and lower your blood sugar through diet and not start them on a medication. So there's so much wide variability in there. It really depends on the doctor.
Okay. Huh. Interesting. So some medicate quicker than others and more than others, I would imagine.
Correct. Yeah.
Yeah.
Yeah. Some will start with multiple medications and go, yeah, it's not enough just to take metformin when your blood sugar is so high. So I'm going to put you on this Januvia or Janumet or whatever, multiple medications to see if we can get your blood sugar down.
Do you think part of that is because doctors are so taxed for time, and like medications are just like the fastest thing they can do, as opposed to trying to fully help somebody? Like, is that one of the reasons why medications are used so much?
Yeah, that's really interesting. That concept of the doctor's time, the way insurance companies handle it is I get paid a lot more per hour. I get paid twice as much per hour if I see 4 patients an hour than if I see 1 patient an hour. So if it takes me an hour to explain what diabetes is, and then explain the options that we have, and then discuss what the patient's able to do, and then choose an option, and then go over how to implement that to get started on that option, that takes an hour or more, and it may take several visits of an hour each. But as far as, because of the way insurance pays, the doctors will rarely do that. In fact, it's my mom went in to see a doctor. She doesn't have diabetes; she has other issues, but she went in to see a doctor, and she brought up one problem. The doctor said, "Okay, here, take this medication." And she goes, "Well, I'm also having no, you can't. You can only talk about one problem per visit." And she was like, "Well, what if that has something to do with this?" "Well, we'll deal with that next time." And I thought that was kind of not a good way of doing things, because what if the other issues that she has will preclude her from using that medication, for example, that he just wrote a prescription for? Anyway, so yes, the doctor's time has a lot to do with whether you're given the medication or not, because it's so quick to just go, "Oh, blood sugar's high? Here you go. Take this prescription and let me know how it works next time and come back." Done.
Yeah. Well, I want to commend you, Dr. Saunders, because you do take time and work with people. That's the difference between you and most other doctors, is you want to get to the root cause and figure out what is really the problem here. And it's hard to find doctors like you. So thank you once again for being that.
You're welcome. Well, there's a lot more doctors now. When I was first going to functional medicine courses, there was 100, 200 people in, at the conference for the whole weekend. Now when I go, there's like 5,000 doctors, at these conferences, and all kinds of chiropractors and nutritionists and naturopathic doctors and medical doctors. It's like a group of people that are all really interested in healing, and not just here writing a prescription and getting people out of their office.
Right. You mentioned chiropractors. Even amongst chiropractors, and I know several of them, you get a wide range, spectrum. Like some people, you're in and out in 5 minutes, and they'll use like the activator and go up and down your spine and a couple things here, and then boom, you're gone. Come in the next week, and then they're on to the next patient. Whereas the chiropractor I go to, I have to schedule at least 2 hours to be in there, because he's doing all sorts of, he's putting me on different frequency machines or doing different analyses. And then he's muscle testing me and adjusting my back and putting my feet in, I don't know what it's called, a foot bath with a electrical coil that gets all sort of gross stuff coming out. So, but yeah, so like he really, he gets deep and digs in. And so it's encouraging to hear that there's a lot more of them nowadays. And so I would encourage people listening, if you can, if you don't have a doctor that spends a good amount of time with you and looks for the root cause, then there's other options out there.
Yeah. So
tying that back into medications, well, let me do a little quick plug. So the Diabetes Reversal webinar, this is our weekly webinar where we offer free information, and Dr. Saunders has been coming on with us now since, August or September of 2019. And all of these are archived on YouTube, and we've covered all sorts of different topics. And so if you want to find previous webinars, you can play them, find us on our YouTube channel, and everything is linked from bartonwebinar.com. That's the easiest way to find our YouTube channel and to also find our products that we talk about. And so Barton Publishing is our company, and we sell the Diabetes Solution Kit. And so this is probably how most of you found us to begin with. This is the report that we've been publishing for, I think, 11 or 12 years now. And Dr. Saunders is our medical advisor. And so in this Diabetes Solution Kit, we teach people how to reverse type 2 diabetes using natural remedies. And so we cover all sorts of things like what you can eat or not eat, how much carbs to take. There's 3 phases that we talk about. Phase 1 is getting down to 20 grams of carbs or less until your blood sugars get under control and you're not insulin resistant anymore. And so all of these webinars have been, for the most part, talking about that. So I encourage you to go to bartonwebinar.com. Leslie will put that in the Slack here and in the chat and in Facebook here. And let's see. Yeah. So let's talk again. Let's talk some more about medications. Touch on probably the most common one. And if you're watching this, if you have a question or if you want to ask about specific medications or how medications work with natural remedies like Synacroma or Nirvala, we'll probably talk about that today. But if you have any specific questions for Dr. Saunders, go ahead and put that in the chat, and we'll get to that. But
okay,
yeah.
So the medications, the most common medication by far is metformin. Metformin is used on just about everyone getting started with diabetes is going to be on metformin at some point. It is an interesting medication in that it blocks the mitochondria's ability to use sugar, and it's a poison, really. But because it does that, it makes something called cyclic AMP, which tells your body to burn fat instead of sugar. So it kind of initiates the fat burning metabolism, and because of that, it's especially useful for starting your fat burning, lowering insulin resistance, because it allows you to take fat out. Whereas normally, when people have high insulin, they can't use fat for energy. So it kind of starts that. So that's a very common one, and people use it a lot. It has its problems. It's not a great long-term medication, and some people get liver failure from it, and it can cause muscle breakdown, because if you have the 2 issues where you can't use sugar because you're taking this poison that's blocking you from using sugar, and then you can't use fat because you have really high insulin and it's blocking you from using fat, now you have no energy for the muscles at all, no energy for the liver at all. And so it shuts down your body entirely, and that's where people get liver failure and muscle fatigue and muscle loss, and get kidney failure from the muscle loss. So all of that can come. It's not without side effects, but it is very commonly used. That one by far.
Yeah.
But
It's interesting. Yeah.
yeah, go ahead.
Well, using metformin, it kind of gives you a clue on what works. And, you know, like you talk about fasting and how that basically does the same thing metformin does when you shift your body from, and when you reduce carbs. So if you're eating fats and no carbs, basically, then your body shifts its fuel from carbs to fat, and which
Exactly.
is, you know, yeah. So way better to do that naturally than using a drug.
Totally, way better to do that naturally, because the difference is when you're doing it naturally, you're making new mitochondria. You're actually improving the function of your mitochondria. Whereas when you're doing it with the drug, you're inhibiting the function of your mitochondria. So you're inhibiting your energy production. So, you know, which would you rather do?
Yeah, for sure. All right. So what else? What are some other medications you could talk about?
So another common one, they've been around the longest, they're called sulfonylureas. They're sulfa drugs that tell the pancreas to make more insulin. And so the way it works is they just put out more insulin. It's like giving yourself an injection of insulin, which could be okay if your pancreas isn't working right and you're not getting enough insulin. That would be fine. However, if you make enough insulin and you start making more insulin, then that can create more insulin resistance. So the main problem with these medications is they cause hypoglycemia, low blood sugar, because you can put out too much insulin and start getting low blood sugar and get more resistance to the insulin that you already have. So long term, they're definitely not a good solution for type 2 diabetes, because you don't want insulin resistance. That's the opposite of what you want.
Mm-hmm. So we've got a question from Shoba. Is there any medication for Drawn phenomenon or Drawn syndrome, DRAWN? I've never heard of that before.
Neither have I.
Okay, so we might need some more info on that, Shoba.
AWN.
Feel free to ask questions as you're watching here, and anything else you'd like to know about medications and diabetes.
Well, what comes up on Google, Drawn syndrome doesn't come up even once. They're all Down syndrome.
Okay, yeah.
Google thinks I spelled it wrong.
Yeah.
So
that's kind of what I was wondering as well.
Yeah.
So yeah. And I don't think there's necessarily medication for Down syndrome. That's just a different chromosomal.
Right. Oh, yeah. But people with Down syndrome often get type 2 diabetes or insulin resistance.
Oh, really?
Yeah, that's not uncommon.
Do you know why that is?
Because they gain weight really easily. Genetically, they're predisposed to gaining weight, and as they gain weight, then they get more insulin resistance, and that leads to diabetes.
Oh, okay. Shoba clarified. He said, Drawn phenomenon is increased blood sugar in the night only.
Oh, okay. Yeah. So the way that happens is people eat in the evening, and then the normal circadian rhythm is you make all of your adrenal hormones, like the cortisol, in the morning. You generally make it in the morning. But people who make the cortisol at night, number one, they don't sleep well. And number two, their blood sugar goes up because it makes them more resistant to insulin, where they can't use insulin. So it's generally an adrenal phenomenon and not a pancreas phenomenon. It could have something to do with eating too. I don't know, but I don't know enough about it. I just making a guess.
So it sounds like something like the 6-10 reset plan might be a good thing to try, and stop eating at 6 o'clock.
That would be a great idea. That just sounds like a great thing to do for that.
Mm-hmm. Yeah. So that's something you're dealing with, Shoba. You might want to try that and let us know if that helps. Ray asks, is it feasible to eat a vegan diet and reverse type 2 diabetes?
Oh, absolutely. In fact, if you look at the McDougall diet, he has a lot of, on the website, he has a lot of people who have done his total vegan diet and reverse diabetes. In fact, there is a vegan ketogenic diet that I put someone on a couple of weeks ago because he says he really wanted to be vegan and wanted to get his insulin resistance down. And so he said, is there anything ketogenic? So we looked it up, and sure enough, there's a vegan ketogenic diet. It's really high in really high in fiber and low in starch and sugar. So, you know, you can have all the broccoli and cauliflower and celery and spinach you want, but, you know, you can't have any carrots or potatoes or sweet potatoes or anything like that.
Yeah. What were some other sources of fats then that aren't animal sourced? You got avocados and...
Yeah, avocado, coconut oil, and all the oils from, you know, grapeseed oil and nuts, all the nut oils, sesame seed oil, and all those kind of things.
Can you talk a second about the opposite of a vegan diet and the carnivore diet, like only eating meat and only eating animal products? Like, what do you think of that diet for carb restriction?
You know, I've had people do the carnivore diet, and I've done their tests, and the tests generally come out really good. I'm really surprised that their cholesterol levels are really good, and they have good ratios of the good cholesterol, the bad cholesterol. I haven't seen anything to indicate that a carnivore diet is particularly bad. I think there's something to this combining thing. The official diet of the American Academy of Anti-Aging Medicine, this is to prevent aging, is called the zone diet. And what that is combining. You don't combine carbs with fats. You eat either fats or you eat carbohydrates. And so I think kind of like it works either way. If you're doing a full vegan diet, or like the McDougall diet, which is like 0 fats, they don't allow avocados on the McDougall diet because there's too much fat in them.
Wow.
So if you did like the difference between a carnivore diet, which is all protein and fat, and the McDougall diet, which is only non fatty vegetables, either way it can work. It's not like it has to be one way or the other. Either way it can work.
Mm-hmm. Yeah, interesting. Okay, so Ray has another question. This is about fasting, and just a reminder that we did cover fasting in one or two of our different webinars in the past. So if you find our YouTube channel, you can hear a whole lot more on fasting. But his question was, is there a fasting protocol that you recommend? I'm looking to do a 7 to 10 day fast once a month. Just looking for your thoughts on intermittent fasting.
Okay. Fasting, just keep this in mind. Fasting means an empty stomach. That's all. If your stomach is empty, you're good. And if your stomach is empty, you're getting more sensitive to your insulin. And if your stomach is empty, you're repairing your intestines. And if your stomach is empty, you're repairing your brain and your kidneys and your nerves and your joints, and everything else in your body happens while your stomach is empty. So how you choose to have an empty stomach is whatever the myriad ways that you can choose having to have an empty stomach is easy. It's easy to do. So if you say, I'm going to do intermittent fasting, okay, there are some principles here for intermittent fasting, and that is, don't skip breakfast, skip dinner. That makes a big difference because that's your circadian rhythm. Your sleep-wake cycles dictate that you do all your repair at night. And if your stomach's full at night, if you skip breakfast and you eat dinner, and your stomach's full at night, then you miss that opportunity for repair. So as long as you're going to do intermittent fasting, skip dinner and eat breakfast. So that's a decent principle. And it turns out that if you ate 2 meals a day, like at 7 and 3, that seems to be, from the research, the best way to do it for intermittent fasting. Mm-hmm. Okay, so then what about long-term fasting? Well, long-term fasting has its own benefits, and that is your stomach is empty the whole time. And because your stomach is empty for so long, you're in anabolic mode this entire time. You're just constantly anabolic, which means you're rebuilding your body. So if you think of all of the time you're in catabolic mode where your stomach was full for years, you never had an empty stomach. You never went a whole day without eating. And all those years of being catabolic, how do you fix that? Well, do days or weeks at a time of being anabolic, which is fasting. So how that looks is I've had people do water fasts for 30 days. In fact, just recently, I had a man this year do 30 days of water only because he couldn't walk across the street without getting chest pain and feeling like he was going to die. And he went to his cardiologist. Cardiologist said, your arteries are so blocked that if you don't get this bypass surgery, then you won't even last a month. And he's like, I don't want to do surgery, doc. What can I do? And so we talked about fasting. He says, I can do that. So he did 30 days water only, like nothing else at all. Unfortunately, he drank too much water and got dizzy once. But at the end of his fast, he was walking around with no pain at all. And now a month later, he's done a couple more 3-day fasts, and he's playing tennis with no chest pain at all. He's fine. In fact, he's probably a lot better off than he would have been if he would have had the heart surgery.
Wow.
So a 30-day fast can be really dramatic and really remarkable. I had somebody else with diabetes who completely reversed his diabetes in 30 days of drinking just bone broth. And he had 3 crock pots going, and one was a beef crock pot, one was a chicken crock pot, one was a ham bone in it. And he would just put some in his thermos and put more water in there and keep them all simmering all day long, all night long for 30 days. And that's all he had. And he reversed his diabetes completely. Had his final tests showed no evidence of diabetes at all. So how you do your fasting is really up to you. If you like broth and you want to do it long term, that's okay. Just one thing, one principle that seems to be the case in all the research is 3 days with nothing, of no food at all. 3 days with an empty stomach, no food or water, seems to be the optimal fast to do.
3 days, no food and water. Okay, awesome. Well, man, nice work for that guy to do 30 days water only. Like kudos to him. Awesome. Did he go back and did they recheck his arteries? And
no, you know what? They don't care. They just go, okay, fine, get out of here. Yeah, you're good. You're good. But they don't ask about how. So he drank too much water and his sodium got too low. He got dizzy and he passed out and hit his head on the piano and really cut it open. So he ended up in the ER one day because he just drank too much water. So you have to be careful with fasting, not to deplete your supply of sodium. Okay.
And how do you recommend keep it? Do you just put salt in your water?
Yeah, I recommend broth. You know what? The broth has fat in it. It has sodium and potassium and chloride, and you're not gonna. You can't go wrong with the broth. The bone broth is great. You know, the water only, you can go wrong. You know, you can get water intoxication, but with the broth, you know, it doesn't have that issue. But because broth has fat in it, he didn't want to do broth. He wanted to do water because he was worried about the fat in his arteries. And he was thinking if he's drinking fat, that he's not going to clean the fat out of his arteries. I don't know what there is to that, but you know what? It worked for him. He's fine now. And it's only been a couple of months.
Yeah. So you said 3 days without food or water. Is that right?
Yeah.
Yeah. So a follow-up question from Claire. No food or water. Does this mean that you can't take your daily medications? That's a good question.
okay, during the time that you're fasting, a lot of the medications are counterproductive. So if you have high blood pressure medications, your blood pressure can drop too low if you're fasting and you take high blood pressure medications. If you're taking diabetes medications, then your blood sugar can drop too low from taking diabetes medications. So you may have to talk to your doctor and say, I'm going to do a 3-day fast. Which medications do I need to avoid?
Mm-hmm. Yeah, good. All right. Ray says, thank you very much. You all rock. I agree. We rock.
Yeah.
Speaking of rock, who wants to dance again? I can get another song going here, huh? All right.
Bee Gees.
Yeah, the Bee Gees. All right. Johanna, what about lemon water?
Okay, lemon water's fine. Now there is one called the Master Cleanse that's been around for 100 years. I think John Christopher was the proponent of that one, and it's water with lemonade, with lemon juice and maple syrup and cayenne pepper, and I've had people do that. And the only issue I have with that is because it has sugar in it, it's going to stimulate insulin production, and you're going to have less of a benefit from it because as you make more insulin, you maintain that insulin resistance. So if it's water with some lemon in it, that's okay too. But it's more similar to just drinking water, and it does have some sugar in it. So even then, I prefer the broth. But it's okay. Yeah, lemon water is great. There's nothing wrong with it.
Good. All right, Bonnie, I see your hand. You've had your hand raised for quite a while here, so she's got a great question here. And thanks for joining us again, Bonnie, and everyone that's been on here multiple times. Always good to see our friends joining us regularly. So Bonnie says, if I'm on a keto diet where I'm in ketosis, can I reduce or quit metformin on a trial basis as long as I continue to test my blood sugar daily?
Yes. Remember our disclaimer, and that is, don't assume that everybody can just stop a medication. But Bonnie, the answer to your question is metformin does not improve the way your body functions in the long run. It's really a short-term way of switching to a fat-burning metabolism, and it can be helpful in that sense, but isn't necessary. There isn't anything that any part of metformin that requires that you continue it, nor is there any problem with just stopping it, especially if you're going to be fasting or doing and you follow your blood sugars and you see if you need the medication. That's one way of determining if you need it. Stop taking it and see where your blood sugars go. And if you go, oh, gee, they went up to 200. Okay, I better go back on the medication.
Yeah.
That's fine.
Good. All right. Let's see. We had someone else with a raised hand. I think they're both down now. Okay. Shoba, if planning for pregnancy, can we still do fasting?
Absolutely. In fact, I have two stories to tell you. One is a famous person from Santa Barbara here got remarried, and he had some children, some older children, and then they were having trouble getting pregnant, and he came into my office because of other issues, because someone told him, he should come in. I didn't know he and his wife were having trouble getting pregnant, but I did know that he was on testosterone injections. And I said, just stop the testosterone injections and just do this. And I had him do a bone broth cleanse. And so he did the bone broth cleanse, and halfway through his 2-week bone broth cleanse, they got pregnant. And he was off of the testosterone that he'd been putting on before. And the other one is a woman who was way overweight, had polycystic ovary syndrome. And I told her, you know what, the only way you're going to deal with this is to not eat. You just don't have any other options, because you've been on metformin for years and gained weight on it, and there's nothing has been working. Your hormones can overpower everything else, so you're going to need to just not eat until the weight comes off. And I didn't know this, but for 15 years, she had been trying to get pregnant, and they had gone to fertility specialists, and they had in vitro fertilization, and within a month she was pregnant.
Wow. Well, that's
so the answer to that question is yes.
Yeah. Awesome.
Totally fast.
Good. More babies. We like babies.
We love babies.
How many babies have you delivered in your career?
Oh, about 200. The last one was the best one. It was an emergency delivery because the midwife couldn't make it. And so the woman, I was visiting my family in Utah, and the woman had her whole room set up. She had a kiddie pool with warm water in it. And she was in labor, and she called and she said, my midwife has been detained and can't make it. And I'm sitting here in a kiddie pool, and I don't have anyone to help me deliver. Can you come over? And I did. And that was the first time I did an underwater delivery. And it was beautiful, and it was super nice. It was really great.
Oh, that's cool. I've always wondered, why do they do underwater deliveries? What is the reason for that?
The idea is to not be such a shock when the baby comes out into this cold room with the air conditioner blowing, and just it's so shocking. They used to think that was good in the old days, where they hold the baby up by his ankles and squat him on the bottom to get him breathing and everything. And now everything is just kinder, gentler. We have a kinder, gentler society now than.
Yeah. Welcome to Earth. Here's some PTSD. Smack, smack, smack. That's the way to start off your life.
I know. Well, that's how we got started.
Well, yeah. I guess it must have worked for some people. So.
Yeah, I was a forceps delivery.
Interesting. That because like you get stuck or something, your shoulders were too broad or something, or
I don't know. I don't have broad shoulders. Look at me.
My doctor told my mom I had broad shoulders. I was going to be a football player, and I never did play football, other than in the backyard. But I always wanted to be the all-time quarterback because I didn't want to get tackled. So.
Wham.
Yeah, exactly. Now I just play hockey and check people through the boards and stuff. So, okay, let's transition back to medications a little bit here. We had a question come in last week from Miss Hogan, and so she's been taking Synacroma, which is our blood sugar formula that has cinnamon, chromium, vanadium, selenium, vitamin D, and vitamin K, and she's been taking this daily now for over 3 months, plus the extra immune system boost of 3 days at 10 per day. So we had emailed out talking about how with the coronavirus and viruses in general and boosting your immune system, take 10 of these for 3 days in a row to just really boost up your vitamin D3 and K2. So hopefully everyone was doing that or has been doing that and is getting their vitamin D. So her question is it true that about now I can start taking Synacroma only twice a week in the future? So maybe talk about that, because you've mentioned how you don't necessarily have to take it every day. So at what point can you go switch to weekly?
Oh, that's a great question. Okay. Everybody's going to be different as far as this goes. And if you're measuring your blood sugar, it's really easy. When you don't need it anymore, you don't need it anymore. Your blood sugar is normal. You don't have diabetes anymore. When your hemoglobin A1C is 5.2, when your blood sugars are always under 100 in the morning when you're fasting, between 70 and 90, then you don't need that anymore. The reason for that is for support. It's to support your process, your transition. But there are other things in there. There's minerals that you still need. And if you have diabetes, then you may be deficient in these minerals, and it's very common. Selenium deficiency, very common. Chromium, vanadium, very common deficiencies. We don't have it in our soils. The plants don't need it. There's no fertilizer that contains it because we don't fertilize large crops with dung anymore. So so we don't rotate the minerals through the soil. So we deplete the soils of minerals, and the farmers only need nitrogen and potassium and sulfur, and they put that on, and they don't add any other minerals to the soil. So the only way to get those is by supplementing. So selenium, you're still going to need selenium. So that's why the transition goes to a couple of times a week. So if you take it a couple of times a week, then you're not going to inhibit your other trace minerals, and you're going to get the ones you need. So that happens when you take it every day until you don't need it anymore, until your blood sugar is normal. So you just don't have diabetes.
Awesome. Excellent answer. Thank you. All right. So Leslie says she's not going to be fasting anymore. Is that because you don't want any more kids?
That is correct. Yes.
You have awesome kids. I don't know why you wouldn't want like 10 more of them running around.
I do. I just will need a lot more caffeine.
Ah, yes. Yeah. My sister has 5 girls, and they're all like young. Well, the oldest is 12, I think. So 12 and under. And boy, does she have a full household. So that is fun.
Well, and right now they're all home doing school at home as well.
Mm-hmm.
So it's, yes, I won't be fasting yet.
Yeah, I saw a meme of a working from home meme where they had the mom on a computer in the corner and 4 kids tied up and gagged on the living room floor. That's how to work from home efficiently.
Yes. All right. Grace says, I've been getting my vitamin D from the sun. Thank God. Amen. Praise the Lord. The sun. Oh, it's so good to see the sun and have warm weather again a little bit here in South Dakota. So all you lucky people in southern and western climates, you don't appreciate it as much as us in the northern hemisphere.
Okay. So can I say there's something about sunshine?
Yes.
You can get vitamin D from the sun, and I suggest testing because there's a lot more to it. If we worked outdoors most of the time, then we would get plenty of vitamin D from the sun. But the fact is we work under artificial lights. We bathe every day. People who bathe every day, you're washing those oils off your skin. Those oils are what is made into the vitamin D by the sun. So if you're washing them off all the time, and it takes about 24 hours once the sun makes your vitamin D on your skin, it can take 24 hours to reabsorb that. And if you're like playing outside, playing football, no shirt on, and you make all this vitamin D, and then what's the first thing you do? You go in and shower and wash it all down the drain. So then there goes all your vitamin D down the drain.
Yeah.
Being careful. And I had a guy who was a beach volleyball player in Santa Barbara whose vitamin D level was low. And he says, no way, I don't wear sunscreen and I don't wear a shirt and I play volleyball on the beach all the time. But first thing you do is after playing volleyball, you go in and shower, wash it all down the drain. So you have to be careful. You may not be getting enough vitamin D just because you're exposed to the sun.
Yeah. All right. We had a couple of questions come in about Janumet. So Gary says, I'm taking Janumet 50 to 1,000 or 50-1000. Besides metformin, it is, it also has sitagliptin.
Yes.
What is the sitagliptin used for? I've read it's not worth taking. Also, is there a bone broth that you recommend? So sitagliptin.
Yeah. Okay. Sitagliptin is a medication that is, it acts like a hormone in your body. It can cause a lot of different problems. And the problem is when you mess with one hormone, you change a whole system of the way those hormones work. And that's the problem. Let's see. So the sitagliptin can cause stomach issues, problems with digestion and absorption, and nausea, vomiting are some of the major things. Sore throat, headache, back pain, joint pain, muscle pain, nausea, diarrhea, constipation. It can affect the way your intestines work. It really, in the long term, it's not a good long-term medication, and it's used to lower blood sugar. But in the process of doing that, it creates more insulin resistance. So it does not make the disease better. It makes a symptom better while causing the disease to progress and to get worse. So I don't prescribe it. In fact, when people come into my office on that, before I even test them, before they're even, I send them out for tests, I take them off of that one, the Januvia or Janumet, either one.
Yeah. Someone else asked, what's the difference between Janumet and Janumet XR?
The Janumet XR is the long-acting form of Janumet. So metformin works for a short period of time. It has a short half-life. So most people take metformin twice a day, unless you're taking the Metformin XR. The Januvia works longer acting, but the XR allows you to just take it once a day instead of twice a day.
Okay.
Extended release is the XR.
All right, Krish. Krish had a couple questions here. I think I missed over them in the chat. How about Metformin XR and 100 milligrams of Invokana? Anything to talk about with those?
Oh, yeah. Yeah, Invokana, which one is that?
Invoke the Google to find out.
Yeah. Okay. Invokana. Oh, yeah, that's Jardiance Invokana. Okay, yeah. Well, so Invokana, dang, so the contraindications to Invokana, it can affect the kidneys in a different way. It can actually increase your risk of lower limb amputations because it affects the circulation by decreasing the circulation. It's not as good for something like cardiovascular disease. So it increases your risk of death from cardiovascular disease. It increases your risk for amputations and kidney disease. It's really not for lowering kidney disease. This is another one that, because of the complications, because of the way it works, it's another one I don't recommend at all. In fact, I take people off of it when they first come in because it is potentially damaging to the body. So the risks of taking Invokana clearly outweigh the benefits.
Okay. So his follow-up question was regarding Nirvala, and Nirvala is our nerve support and nerve pain formula. This has alpha-lipoic acid, 600 milligrams, and 75 milligrams of benfotiamine. And his question is whether this helps Parkinson's disease.
That's a good question. The answer is maybe, but probably not. Parkinson's is primarily a dopamine problem and is in the central nervous system. The ability for the body to make dopamine is decreased. So it's not the same as a peripheral neuropathy where people have a hard time moving in diabetes because their peripheral nerves don't work, and it's because of a circulation problem in getting the nutrients to the peripheral nerves. And so the Nirvala works on that, on improving the circulation and improving repair of the peripheral nerves. Whereas the Parkinson's is the central nervous system, and it's a completely different problem.
Mm-hmm. So Gordon has a question related. So can neuropathy be reversed?
Oh, the answer is yeah, absolutely. I've seen it multiple times. I have people in the nursing home who reverse their neuropathy, and who didn't even have diabetes, who had neuropathy for other reasons. But I put them on Nirvala and they get better. Not everyone gets better. I have people who come back to me and say, I still have this numbness and tingling. I've been taking your medication, it didn't work. So there may be other reasons for the neuropathy that Nirvala is not going to address, but certainly for diabetic neuropathy, that's what we created it for.
Mm-hmm. All right, let's get to our last question here. This is actually the second part of Gary's question earlier was, is there a specific type of bone broth that you recommend?
Okay.
Buy chicken broth from the store. Is that basically the same thing, or what's the best way to do it?
Yeah, the only thing I say to do it is avoid the ones like consommé and the kinds of things that aren't broth, that are for making soups, like soup stock and stuff like that. Because often what they'll have is sugar in them, and they'll have other kinds of spices and MSG and stuff like that. It's better to get just plain bone broth and then spice it yourself. And we have bought, I've used from Costco, they have those boxes, big boxes of bone broth. I've used that, and that works just fine. And what I do is I put it in a pot, and then I spice it. And I like putting celery in, so I always chop celery and onions and put garlic in it. And then from there, I can add any kind of spices. Sometimes I'll use turmeric just to give it a different flavor. I like the turmeric flavor. And then other times I'll make sort of a Mexican style with red pepper in it, or green peppers, and make it hot. It just depends on how you like it. Spice it the way you like it, so it's something you enjoy eating. So it's not something that you go, oh crap, I'm gonna throw up if I have another drop of bone broth. Don't get there. Don't go there. It's not worth it.
Well, so you can take like a chicken carcass or turkey or a bone from beef or something and just put it in a pot and boil it for a few hours. Is that kind of how it works?
Well, kind of. I usually boil, if I take a whole chicken, a whole like small fryer chicken, I put it in a pot and, fill the pot with water and then simmer it overnight, just on a very low boil overnight. And then I take the whole thing out and take all the meat off, put the bones back in, and then let it simmer for another day. And then I spice it up and put the celery and onions and garlic and spices in. And I always put salt and pepper in. That makes it really good. And so the bones have been simmering there for more than a day.
Okay. Yeah. Well, good stuff. All right. Well, this has been a great call. We covered a lot of topics. And Leslie, housekeeping here. I'm just thinking, can we stop recording and then keep going? Because I want to see if I could ask people to stay on. I want to ask them about our name, that question I had earlier, to get a little feedback.
I can stop the recording. And do you want us to end it on Facebook as well?
I mean, you can keep it going there. So I'm looking for some audience participation. So I'll just wrap up here before you stop recording. Thank everybody. Thank you all for joining us, and visit bartonwebinar.com. If you are not already registered, you can register for these calls every week. We're now doing them Tuesdays at noon Central Time. I hope that new time works for everybody. And apologize if the earlier time worked better for you, but you can always catch the replay, and you can message us with questions and we can answer them on our calls. So thanks again, everybody. Thank you, Dr. Saunders. And
you're welcome. Good.
All right.
All right.